ultimately, when everyone is considering in today's world what is the best approach to a herniated disc, so the purpose of our consultation today is to establish that there are several viewpoints that are available for people to approach a herniated disc. What is a herniated disc? This being the nucleus pulposus, we have what we call annular fibers that hold the nucleus pulposus in the center. The problem is that this literally has the ability to break through those fibers, pushing on a nerve that sends pressure or pain all the way down a leg. You can have an epidural where they'll actually stick a needle right into this area here, and when the needle comes in, it literally allows a certain amount of medication right around the nerve here to reduce or relieve inflammation. Having said so, it really doesn't answer the first question, which is most important. Why is the disc herniated? What is it that's going to, one, relieve the impact, and most importantly, what are we going to do for the future? Okay, now a neurosurgeon or orthopedic surgeon will literally cut this thing off right here, and some can cut the entire disc out. So they will literally, some will take a third out, some will take the entire disc out, some will even use instrumentation to the right here that you see to stabilize the joint. Some will put artificial discs in. It really depends on the prevailing thought and experience of the doctor who is officiating or managing the case.
So the surgery being the only way that they feel as though they can relieve that pressure is to take out something that's obstructing the release of the nerve.
Okay. So what's happening here is, some will do this. If it does relieve the symptoms, happy days, you go along your business until what? If there's another underlying problem, kind of like the misalignment of a car, if you don't take the alignment, it still puts pressure on the side of the tire. The analogy works well here because once you've worn the tire out, it's going to blow.
Right.
So it's really important to really assess what are the other challenges why this disc is being herniated. Okay. So we on the other hand use a different approach here. We use a process of looking from the bottom up. So what does that mean? So if we look at a structure, if something is going on from the foot up, it can create a huge distortion or misalignment that puts too much pressure on the lumbar spine. Mm-hmm. But in fact, it can start all the way down at the foot. If we then focus on the foot, we can, one, reduce the pressures that are being compressed on the spine itself, looking at the ergonomics of the job, the nutritional of the client, and so forth. And in most cases, this has a much better approach to long-term health, longevity, especially if these clients are at very young ages, because to do that type of surgery will compromise the actual motor unit or the structure where the disc was, and it's only a matter of time it starts to create more problems above and below the area of damage. Okay, so foot plays a major role in our assessment of the lumbar spine, but in addition to that, then what we want to focus on is we have a process called spinal decompression here. So rather than cut the disc out, we actually create a force inside the disc that decompresses and slowly over a period of time pulls the disc back in while doing the alignment of the foot all the way up, and then allowing this to heal up all on its own. And the procedure is very successful. It's about 80% successful, and with that, we feel that's the best approach in terms of the initial consultation, evaluation. And frankly, we normally give a couple visits just to see if the person will respond to the treatment. If they do, then they're a candidate for the program. If they don't, at some point, it might be considered surgery. But just because they fail in spinal decompression does not necessarily mean that surgery is the best answer. Everything has to be considered as a part of that, because ultimately, let's face it, some people die in surgery. They don't come out. So it's really important to address all the risk factors involved with that so you can make a prudent decision.
How similar is the decompression treatment to what it is that I just went through? Same process?
That was exactly what you went through.
Okay.
So yours we're doing on the front side. You don't have a herniated disc yet, but that pain that you're talking about in your buttocks that goes down your left leg, in fact, is the very first sign of straight leg raise, indicating there is nerve pressure already in your lower back at L5-S1.
Okay.
So our job is to make sure that doesn't turn into the full-blown herniated disc, unless you'd rather wait.
Right. Okay, and so Stacy's profiler, she did this, I guess, 6 years ago, and so here she is in a situation where it's recurred, and so I guess it would stand to reason that if it's recurred once, there's a possibility of another recurrence on down the road.
Well, frankly, just remember, this is, let me show you one other viewpoint here to help you understand this. So let's look at disc alignment. And when we look at a disc, you know, the fact is there's several things that causes it to break loose. So you can have a lateral disc left, you can have a lateral disc right, but you can also have a central disc which will cause symptoms down both sides. But additionally, if you break through the annulus, it can break through and actually then many times will then require surgery. It is a free fragment. So our job is to make sure that this can be pulled back in before it becomes a free fragment. And in all three of these conditions, right, central, and left, in most cases, about 80% of the time, you can eliminate this. But it is a longitudinal problem because the concentric fibers or annular fibers, you keep breaking through one layer of fibers at a time. And each layer can cause all that pain to be reintroduced until it completely becomes what? A free fragment. And now we're too late.
Okay.
So it's really important to try to address those issues and create a much healthier disc environment long term.